Welcome again, everybody, to a new series of videos. And in these videos, we are going to discuss the radiographic appearance of restorative materials that are used in different treatments of restorative dentistry, and how would they appear in the radiograph. To start with, we have to have an idea about the appearance. What causes the appearance of these materials to differ from one substance to another? Actually, the main factor that controls the radiographic appearance of different materials is the atomic number of the material. By atomic number, we refer to the density of the material, that is weight per unit volume. The higher the density of the component, either it is a single component or multiple components, which is usually the case in the restorative materials, the higher the atomic number of a material, of a single substance or from different substances, the higher will be, or the more the radio opacity of the material. Why it is radio opaque? Because it will stop the X-rays, it will prevent the X-ray photons, it will attenuate the X-ray photons so that it will prevent them from reaching to the film or to the sensor, and hence it will appear radio opaque. The most commonly used filling material previously and now even is the dental amalgam, and dental amalgam would appear completely radio opaque. I think it is the most radio opaque material of all the materials that are used, and it appears radio opaque, as we know, because of the composed of different materials. All of them, they have to all of them are of a higher atomic number, and thus they would stop the X-ray from passing. In this radiograph, where we will find two amalgam fillings, one is on the lower 7 and another one is on the lower 6. See, the amalgam filling here appears completely radio opaque, white. It is even whiter, more radio opaque than the combination of two enamels of two teeth, which are overlapping over each other. Amalgam, of course, from the shape of the cavity, depends how the cavity was prepared, whether it is a class 1, class 2, MOD. But once we look at the radio opacity of the material, it will appear completely radio opaque, and we will see future radiographs where we will compare between the radio opacity of amalgam in relation to other filling materials or restorative materials. Another thing I want you to have a look here, compare the radio opacity of amalgam over here in the lower 6, compare it to this radio opacity over here. Now you see there are two different radio opacities. One is very radio opaque, which is that of an amalgam, and the other one, which is just beneath it, has a lesser radio opacity. This is the liner or of the material, which is zinc phosphate cement, which is usually used as a liner with amalgam. Mind you, sometimes the liner material, whether it is a zinc phosphate cement, sometimes oxide eugenol, and it was also, some of it was left as a liner. Zinc for lesser radio opacity if it is compared to the cement. Sometimes you will even find, as we will see in other radiographs, you will find a subliner, which is mostly Dicel, that is used especially in deep cavities. So you will see the subliner, aligner, and the amalgam fill.